So we did an online survey on diabetes and we asked them the first medication that they were given when they were diagnosed and any additional medication that were given over time. So these are our results. So we got 111 responses for the first question, how long have they been diagnosed with diabetes? We've had several answers. The longest was 30 years, 15, 10, just recently, others 3 years ago, 10 years ago, more than 4 months. So these are of varying lengths. For the second question, we asked them what medication was first given. So the most common answer would be metformin. Others are actually started with combination drugs, those with named duo or together with metformin, glycoside. Sometimes others given insulin for the first time, although we don't know if it's a condition that is already requiring insulin, like say for example type 1 diabetes or sometimes gestational diabetes. And as we move forward to the next question, which includes the additional medications that were given over time, others have none, but it is very salient to notice that there were increasing or additional medications that were given to lower blood sugar, signifying poor blood sugar control. And another factor here would be the need for drugs that lower blood pressure and cholesterol levels, specifically triglycerides and VLDL, which are dangerous to one's health. Others who started with oral medications eventually convert into insulin injection just so it can be controlled. However, that is still not sustainable unless it is paired with low carb nutrition, wherein we can see here that not everybody is doing, and most likely not everybody was advised to do so, including intermittent fasting, which actually has been shown to really improve blood sugar control for those who have done it appropriately or under a medical supervision. And when asked what medications do they still take now, so usually it's combination drugs, and others sadly now become insulin dependent. And it is of no surprise that others still need additional oral medications in addition to insulin injection, just so blood sugar can be controlled and blood lipids can be lowered as well as blood pressure. This approach is really not sustainable without proper medical nutrition therapy because it is not addressing the root cause, which is actually insulin resistance. Insulin resistance is the root cause of metabolic syndrome, wherein there's elevated blood lipids, especially triglycerides and VLDL, as well as increasing weight and poorly controlled sugar, and eventually other signs of inflammation such as tumor formation, allergies, autoimmune disease, and end organ damage can occur without properly addressing the root cause of diabetes, which is insulin resistance. And the only way to do that is actually to lower the need for insulin in the first place, and that is through dietary management. We can appreciate it even more if we look into our ADA guidelines, even the American Diabetes Association, where they actually emphasize on the need for dietary management, improvement of the patient's nutritional need and well-being, which starts with proper education specifically on the amount and the kind of food that they eat on a day-to-day basis. Medical nutrition therapy is very important, especially focusing on carbohydrates. And with this, we can see that ADA actually emphasizes on nutrient-dense carbohydrate sources, emphasizing on non-starchy vegetables and avoidance of sweets that can increase insulin need. With lowered carbohydrate intake, there is a low need for insulin and insulin resistance can be reversed. Management of diabetes might or might not need medications, but one thing is important. All diabetic patients should be counseled with the right nutrition, and there should be a greater focus on medical nutrition therapy because medication alone will never be sustainable unless it is paired with proper nutrition, specifically focusing on low-carb, nutrient-dense foods, and that is limiting the net carbohydrates or overall carbohydrate and insulin response of the body whenever we talk about management and controlling diabetes and hopefully preventing complications and even possibly reversing it. So that's it for now. Remember to stay low carb so that we all stay safe.